risk with laser spine surgery is just like the risk with any type of spine surgery. That is, number one, probably the biggest risk. The biggest risk is you could have the surgery and may not get better. And that's a significant risk. And that risk varies anywhere from about a 1% to maybe as high as a 50%, depending on what kind of problem you have. For the average patient, probably the risk of this, of you having surgery and not getting better, probably about a 5 or 10% chance that you could have surgery and may not get better, or that you could have the surgery and get better, but the problem can reoccur. So that risk is about a 5 or 10%, and that's your biggest risk. There's other risks with spine surgery that are the same as any spine surgery or any surgery that you have, such as bleeding, infection. Those are obviously risks with any type of surgery, but those are typically very, very low risk, and that type of thing rarely occurs. You can always have to have additional surgery for a spinal leak, which is some spinal fluid can leak out, and that can give you headaches and swelling and leaking from the back, and if that happens, you have to go back in and have more surgery. But those type of complications and risk are typically very low. You can end up with spinal instability. That is, you can go in and trim out some of that bone and then make the bone unstable, and then you have to go back to a spinal fusion sometime in the future. All those risks, which can occur, I've seen them occur, but they're typically very low risk. The real risk, probably the biggest risk for most patients, that is, you could have the risk, you could have the surgery, and you may not get better. And so 90 to 95% of the time you get better with surgery, but probably 5 to 10% of the time you may not get better, and that's your biggest risk.